Good afternoon, this is Richard Higgs from Harold Stevens. I'm a later life financial planning specialist, and today I wanted to talk about NHS Continuing Health Care. It's an area that families perhaps don't discuss until something happens, and it's often a really stressful time trying to navigate a complex situation, both financially and in terms of the care package that you're looking to organise. So I thought it might be quite good just to kind of demystify a little bit NHS Continuing Health Care, and at the very least ensure that you look into it or be mindful that it actually exists, because it can make a huge difference financially to you and your family. So why is this important? Well, really it's because NHS care is, as we all know, is free at the point of need, and that compares to social care, which is means tested, could mean that you're paying £75,000 a year plus for your care needs. So the difference is you could end up paying absolutely zero through the NHS Continuing Health Care, or have all your money or your assets spent on care through social care. So that's why it's such a hot topic. It's you could have two patients or two people lying side by side in an in a nursing home with very similar care needs, round-the-clock care, washing, feeding, very similar needs. One of the people lying on a bed might have to pay all of their social care costs and their residential costs. The other person, who it might have just a medical condition which makes their situation a little bit more unpredictable, might have all of their care costs and their residential costs associated with that paid for by the NHS through continuing healthcare. So because the rules are applied inconsistently throughout the UK, it's a complex area. It does mean that it's an important area to look at if you are looking to go into a nursing home, or you're a representative looking after someone who is potentially needing care. Something to look into. In terms of funding routes for care, so we have self-funders, so anybody who has over 23,000 who doesn't qualify for NHS care basically has to pay for all of their long-term care costs. It does mean that you get extra choice, there's more flexibility, you get choice of home. You do get the funded nursing care contribution for any nursing payments if you are in a nursing home. Then you've got social care costs. So again, you've not qualified for NHS Continuing Health Care, but you don't have the assets to pay for your care. So obviously you pay for your care as a contribution from your income. There's less choice if the local authority are paying for your care. But there is third-party top-ups allowed if the local authority are paying for your social care. And then the third one is NHS Continuing Health Care, which is available, as I said, free at the point of need. NHS would pay for everything. There would be much less choice about the setting that you receive that care. And no third-party top-ups are legally allowed through continuing healthcare. The criteria to qualify for continuing healthcare is extremely strict. We're talking about the very most vulnerable clients, or patients, I should say, in the country. It's a very strict criteria to actually qualify for it. But you know, we're in an ageing society, and the number of people eligible is actually declining year on year. So you can see that it's becoming more and more difficult to get continuing health care. But I would say that there's a lot of people in the UK that should be qualifying for it that aren't or are not claiming it. So definitely be mindful that this is something that is available to you or your relative who's going into a care home or is needing significant nursing support. It's something to look into, to at least apply or at least be aware that you can certainly go through the initial stages to see whether you qualify or not. So I'm going to, a little bit of interaction, I'm going to do a true or false question, and maybe you can have a minute or so to think about whether these questions around continuing healthcare are true or false or not. The first question is, if you're assessed for continuing healthcare, if you are eligible for continuing healthcare, is that for life? Well, actually, it's false. So you have a review process, so people can be reviewed and then subsequently not be eligible for continuing health care. So it's like an ongoing process. Equally, if you go through the admissions process and then you find out that you're not eligible, you can apply again in future years depending on what your health needs are. Continuing health care can be provided in a care home with nursing, can only be provided in a care home with nursing. And again, that's false. Continuing health care can be provided in any setting, including your own home. Eligibility for continuing health care can be based on a certain diagnosis, like an aggressive cancer. And again, that's false. It's another myth. We're talking about needs-based as opposed to inputs. So it doesn't really matter what diagnosis, and we'll come on to dementia. It's all about what needs you have as a person. So it's nothing to do, it shouldn't be anything to do with diagnosis. It should be all assessed on a needs basis, what your needs are for care. Hardly anyone with dementia gets continuing health care. Again, that's false. It's another myth. There's a pattern developing here. No, that's not correct. It's done on a needs basis again. So it doesn't matter what your illness is, what you've been diagnosed with. It's all about what your need is for care. I mean, it does so happen that most people that qualify for continuing healthcare actually do have or are living with dementia. But the diagnosis or not of dementia shouldn't have anything to do with your eligibility for continuing healthcare. And finally, the Integrated Care Board, the ICB, are allowed to cap the cost of a care package, and then individuals can then top up to get a more expensive home. And then again, that's another myth, another false answer. So you can't do third-party top-ups if you qualify for NHS Continuing Health Care. I'm just going to come on to the definition of continuing healthcare that's actually in the legislation. So I think it's just important to note exactly what we're talking about here. So NHS Continuing Healthcare means a package of ongoing care that is arranged and funded solely by the NHS, where the individual has been assessed to have a primary health need, as set out in the national framework. Such care is provided to the individual 18 plus years old to meet health and associated social care needs that have arisen as a result of disability, accident or illness. So that's what the criteria, that's what definition of continuing healthcare actually is. So if you're in a position or your relative or you're a representative or an attorney for someone who's in this situation, if you're in a really bad way, you're looking to move into a nursing home, I would definitely at least be mindful of the continuing healthcare application process. So initially, there's an initial screening checklist which should be performed by a professional. And this will really see whether you have any chance of qualifying for the Continuing Health Care. Anybody who's moving into a nursing home is allowed one, so that's a right to actually have an initial checklist. And if you get through that, the second stage is a multidisciplinary team that will do a full assessment based on a decision tree. That team should comprise of doctors, carers, social care workers, the family, who will look at all aspects of your situation, your needs. There should be people who are actually caring for the individual. You know, it shouldn't be people who are kind of remote from actually what's happening to that individual. It's a full process, and at the end of that process, there will be a decision made on whether you are eligible for continuing health care. If, as a result of the assessments, that the result is that you don't qualify, there is an appeal process. It's important to know. We can signpost you to legal professionals or social enterprise companies who can help you through that appeal process. Or the decision is that you get continuing health care, there'll be a commissioning cost package set up for you, and then you get your NHS care. That would be reviewed every 3 months and then every 12 months. So as I said in the true or false questions, that's not certain that you'll get it forever, but there is a review process in place for that. Importantly, throughout that application process, it's important that you are the centre of all the decision making. There's plenty of communication to you. The process, as you can probably imagine, is hugely stretched. So, you know, stand up for yourself, get your representatives to understand and communicate with whoever's making the decisions to ensure that you are first and front and centre of that process. A few top tips, I guess, for people who are thinking about this area. First thing really is to prepare or start early. As I said at the start of this presentation, often families only really address this at the point something's happened, someone's been diagnosed with something, and it becomes a really stressful time. It's a complex area. So plan early, you know, plan where you would like to receive your care, how you would like to receive your care, how you're going to fund it in the most tax efficient way, what kind of packages are there. All of these things can be planned in advance to make things as simple as possible. Communicate these things to your loved ones, to your attorneys. Ensure you do get your lasting power of attorneys organised. There's 2 documents, a financial and property one and a health and welfare one. If you aren't able to deal with your own affairs because you've lost capacity or you just don't have the ability or will to deal with your own affairs, it's important that you've already nominated people that you trust to deal with those affairs when the time comes. The consequences of not doing so don't even bear thinking about. You'd have to apply to the Court of Protection. It's an extremely lengthy and complex and expensive process at a time when you need help urgently. So definitely get your lasting power of attorneys organised. Use all your entitlements. Use the 12-week property disregard entitlements, where you don't have to use your property as an asset when you first move into a nursing home. And also consider the deferred payment agreement as well, instead of going to off and selling the home needlessly if that's not what you want to do. Be at the centre of all the decisions. So again, like I said, the system is really stretched. It's a stressful and difficult time for the people working in that industry. So make sure that you're front and centre of all the decision making, all the process. You know what's happening. Your representatives can work in your favour and work and make sure everything is done in your interests. In terms of evidence, just make sure that everything is, evidenced. Any emails, files, even verbal conversations. It's just important that you keep a good documentation of what's going on in that process, just in case that you need to fall back on that in the future if there's an appeal or if anything needs to be organised in the future. And really just try and everyone's entitled to a checklist. So everyone's entitled to that initial checklist. So like I said, there's a lot of people probably in the UK that are probably should be qualifying for CHC, Continuing Health Care, who actually aren't qualified or aren't even considering it or don't even know it's available. So be really mindful that this is an available thing. This is a thing that you can apply for. Everybody is has the right for an initial checklist. So if you are going into a home or you're needing nursing care, pretty intensive nursing care, definitely look into it. Get in touch. We can signpost you to navigators. We can talk to you about financial packages, care packages, which can really help pay for the kind of care that you want. Or, as I said, if you qualify for continuing healthcare, that can make a huge difference to the household's assets. I hope that's been useful as an initial kind of process and background behind continuing healthcare. If you are in this situation, or if you're looking to or thinking about potential care in the future, just definitely get in touch initially. We can have a free chat just to see what's the situation, how we can help. We have a team of professionals and legal associates that we can signpost you to if need be, if that's kind of the route you're going down. But hopefully, again, that's been useful, and we'll see you next time. Okay, bye-bye.